For men at risk for prostate cancer, there's a new test worth considering. Prostate MRI is a safe, highly accurate test that can detect and assess prostate cancer. It can also rule out the disease, and that can help you avoid an unnecessary biopsy.
I had an initial image, an MRI is what we're talking about, at a very renowned teaching institution in Northern California. And that gave information that indicated I needed to pursue further diagnosis. So my initial biopsy came back grade 1, which is hardly anything to worry about. But Dr. Schwartzberg wasn't, he read the biopsy and looked at the images and they didn't add up in his experience. He felt like something was off.
Based on the other factors, putting everything in context and evaluating all the different data points, we were concerned that there was something more serious going on. Specifically, Dr. K's PSA level was going up. There's a biomarker called PSA density, which is taking the PSA value and dividing it by the size of the gland, and that was elevated. It was at a high level that would be unusual in the setting of just the lowest type of cancer.
And so he encouraged me to consider letting the prostate heal from the original biopsy and then coming back and having it done again, which I agreed with because I understood his reasoning. And so I did, and this time we had IHS do the imaging. He showed me the side-by-side on the computer. He was kind enough to spend a lot of time with me, which was a very big deal in this day and age. And the first MRI was, let's say, out of focus. It was in the one that they took here was crystal clear.
Once we did the follow-up MRI imaging healthcare, we sat down and looked at the images next to each other. The initial MR that was performed, and then the new prostate MRI done at Imaging Healthcare, and Dr. K was able to see that there was a clear difference, that the new exam very well depicted an area that was of quite concern, and that then allowed us to really position our needle exactly in the spot that was most concerning the MRI.
And that was critical in going into the next phase biopsy, where it's guided by needles using the imaging. So this biopsy unfortunately came back very, very different. It came back fairly aggressive and it needed serious treatment as soon as possible.
We have another tremendous tool at Imaging Healthcare to help us get the highest quality images, and that's called restricted spectrum imaging. We've implemented that imaging into our program. It's become profoundly helpful in me when I'm making my diagnosis. It's also become extremely helpful for our radiation oncology colleagues who are using it to design their radiation dosing plan so that they can direct most of the radiation just to the tumor while sparing the rest of the gland with a lower or providing lesser dose to the rest of the gland, which gives the patient the maximum opportunity of maintaining their gland functions, which is incredibly important. So these are the types of things at Imaging Healthcare that set us apart.
If you have 2 or more of the risk factors, you may be a candidate for prostate MRI. But not all imaging centers can perform prostate MRI. Only Imaging Healthcare Specialists has San Diego's leading prostate MRI risk assessment program, which includes the most up-to-date MRI systems, specially trained technologists, and the region's most experienced radiology team in performing and interpreting prostate MRI.
I had treatment, and in subsequent follow-up lab tests, they've all been as good or better than I could have expected. So I'm very, very grateful to Dr. Schwartzberg and his expertise and time that he put in, because it absolutely made I don't want to be dramatic, but maybe a life and death difference in my case.
If you're at risk for prostate cancer, consider prostate MRI. Schedule yours today